So don't worry about this lecture because this is beyond specialist level. It's almost like sub-specialist level already. So just enjoy the information. Okay, so I will just briefly talk about what are the type of research that this society will be related to. As you can see from the title, it is from workbench to clinical application. As Dr. Zasli pointed out just now, the most common oral disease is caries and periodontal diseases. So what we are trying to do, of course, if we can prevent disease, that is the best because prevention is always so much more cheaper and easier. But we also do research to see how we can improve in terms of treatment. Right? So this is the top one I took from internet. The bottom photo is one of my patients. So even in this era, we still see this kind of periodontal disease. As the title of this society, oral microbiologist and oral immunologist, these two are inseparable. If we don't have microbial on us, we will not survive. We get microbial from the moment we are born. It depends on whether you are born vaginally or through cesarean section. The type of microbial will be totally different. And as we grow up, whether you are formula fed or through the breast milk from mothers, your microbial will also be different. So that is how the microbial train the immune system in the gut. So the next thing, our oral cavity is the second largest home for microbe. It is not very extensively studied, but there are more and more review papers talking about how the oral cavity is actually having the same training ground. You can see that is the tooth and there is the epithelial lining. And the tooth is always covered by a layer of biofilm, isn't it? If you brush, the moment you brush, the biofilm will form back again because we need the biofilm, the initial pellicle layer, to protect our teeth. Our teeth are actually exposed bone, so we need all this pellicle layer to protect us. And on the junctional epithelium, there's actually a layer of mucosa just like in the gut. That is where all the surveillance cells are always in contact with the oral microbiota and training the localized immune system. So they understand well what are the normal bacteria that is always around, and when there is some other bad bacteria suddenly become higher in numbers, that is when problems set in and they will fight. Okay. So in the current era, we are slowly, or probably not slowly, if you go to hospital, you will see a lot of signage telling people to be very careful when using antibiotics. Because we realize we need all these microbes to keep us healthy. So we are moving away from antimicrobial to bacterial friendly. And if we can, immunomodulation. And the other things we can research more on is how to dampen the overreactive inflammatory response, antioxidant. So eventually what we want to achieve is a wholesome oral health, which will give us good oral health, good general health. And of course, as we growing older, we wish and we aim to be brushing teeth inside our mouths instead of holding it in our hand. So with the current technology, you'll be able to see a 3D picture of biofilm. If you look at the picture, the tooth that is labeled as tooth, that is different layers of bacteria. This is supragingival biofilm taken from one of the volunteer. So every bacteria, they have their location where they are supposed to be living and interact with each other. And all of them are there. We used to think that Papillomonas is bad, but Papillomonas is there. It's just that they are in smaller number. Streptococcus, we think Streptococcus should be more of the primary colonizer, right? So in a healthy situation, their numbers is higher. But even when there is caries or periodontal disease sets in, all the same bacteria are still there, just that their proportion change. Okay, now we can look at what are the type of research some of the current members are doing and some of the potential members that may join our society. Some of us are working directly with bacteria such as Papillomonas, gingivalis, Streptococcus mutans, or Candida. And as Dr. Zazli mentioned just now, some of us are doing parasystemic relationship. We look at the changes in inflammatory markers, the changes in the bacterial profile, obesity, para relationship, and then osteoarthritis. And there are also researchers from as far as Belgium. Professor Victor, who is working on probiotics, which has been shown to improve the oral health of patients after using the lozenges or the probiotic drops. And in Malaysia, we have the symbiotic toothpaste developed by Dr. Hafiz, where he extracted the pisang pomace skin and mixed with Streptococcus cerebrus, and that becomes a symbiotic toothpaste, which is now already in the market. There are also a group of researchers from UKM working closely with medicinal plants, because all these medicinal plants is high in polyphenol. They have antioxidant, a lot of anti properties. For example, like ginger, it can help to remineralize the teeth and also anti-cancer. And then mushroom. Mushroom is also, besides giving general effect on general health, it's also have been used in anti-cancer treatment, because there is this property called lentinan. Lentinan is for anti-caries. We are having hot weather now, but we should be very blessed because the sun gives us a lot of goodness, which is all kept inside the tropical fruits. You can see it's high in vitamins, antioxidants, like pineapple, it is anti-plaque and stain removing. So these are some of the research that are done by the members in the group, and maybe potentially other researchers can join us eventually. So this is from the World Health Organization. It wants us to prevent oral diseases by having daily toothbrushing with fluoride toothpaste. But if you understand there are cultural beliefs where they don't want to use the modern way of brushing teeth. So all this research, if we can have alternative for people probably in the rural area, if they don't believe in fluoride toothpaste, what about all those other plants or fruits that can help them? If that is an alternative, then we can customize all these treatments for this group of people who is not into modern medicine, right? And then, we should also limit sugar intake. So what is the alternative? Instead of just telling people don't do this, give them an alternative. If they cannot eat something sweet, which is going to give them caries and diabetes, there are options like fruits. which is beneficial. Okay, of course, tobacco we shouldn't be touching at all, and alcohol consumption, keep it to the minimum. There are also research work where they build biofilm models, where this is put inside this petri dish, and then see what kinds of bacteria will come and stay, will colonize the enamel disc. And we have researcher from UK who is researching on restorative material, which is less blood retentive, and antibacterial intraoral surgical wound dressing. Implant, a lot of you may be interested in doing implant, but we are seeing a lot of peri-implantitis problem. So besides having this normal XLA active or of course surface roughness, other research that people are now looking is probably something that is more bacterial, can add probiotic onto the implant surface to aid in the initial healing phase. And then we also have medical specialists with us, where she has cultured dental bacteria from brain abscess. Okay? So for future technology, just like I talked about the implant surface treatment, antibiotic beads and high-dose antibiotics in the spaces, or if you have heard of nanotechnology, you can use it to deliver probiotic because it can avoid the digestion by oral and gut. So all these are very advanced knowledge, but it's very interesting. If you sign up as members, you can join our webinars, or if you are able to come and join us physically, listen to all these experts talking about all these advanced in dentistry, rather than just the normal routine scaling, filling. Right? So lastly, from World Health Organization, when we talk about good oral health, it's not just about teeth. We want it to be overall, which include our general well-being and psychological as well. Okay, thank you.
Thank you, Doctor. The amount of work that is going on in the research. So I believe you're a paleontologist. So how do you juggle your work and lab? How's your day like?
It is not easy. A lot of time after we finish the teaching session, if the postgraduate need to meet us, we call them after working hours as well to do some Zoom meeting, because there are things that they meet in the lab, they need some explanation, they want us to help them to sort out cases. So morning clinic, afternoon clinic, then I have to see the postgrad student after office.
So no overtime there.
Cannot claim.
Any question from the floor? If there is any